Hello and welcome to athenahealth Career Solutions webinar. We're excited to be presenting Accessing Your Patient Records During a System Outage with ChartGuard for athenaClinicals. My name is Chelsea Grover and I'm the Marketing Communications Coordinator for athenahealth. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded and that we'll send out a copy of the slides along with the recording within the next week. Next, for those of you who aren't familiar with athenahealth, I wanted to share a bit of who we are with you. Our goal in life is to make delighted clients by helping them get the absolute most out of their healthcare software investment. We're passionate about providing solutions for healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. So on to some housekeeping notes for today's presentation. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Tom Seco is athenahealth's Business Development Manager and a subject matter expert on the product. And Joe Schultz is the Director of Product Solutions at athenahealth, which means that he and his team are the people that actually built this great program and thus is in a great position to demonstrate it. So Tom, I'm going to pass it off to you. Feel free to get started when you're ready.
Okay, thank you very much, Chelsea. And thank you everyone for joining our webinar about accessing your patient records during an unexpected system outage. Here's an agenda that we're going to cover today. We'll gain an understanding of why practices invest in this type of solution. We'll talk about EHR dependencies. We'll talk about how it works. We'll show you the output that's generated by ChartGuard so you get an idea what that looks like. I'll come back on and give you a quick brief overview of who athenahealth is, and we'll answer your questions. In the beginning of the presentation, I'll talk about ChartGuard and how it looks, give you a high-level overview. And then in the middle of the presentation, I'll turn it over to Joe Schultz, and he's going to talk you through how ChartGuard works in the Athena environment. So what we're talking about today is simply a business continuity solution that ensures you are prepared for a downtime situation at each of your office locations, clinical locations, department locations, and that you have access to your patient charts during an EHR downtime situation. We all know that our EHR systems are based on complex technology. Between our own systems and our third-party hosted systems, we have servers, we have workstations, we have tablets, we have scanners, we got internet connections, we got local area networks, T1 lines, fiber lines, VPNs, wireless networks, wireless base stations, power systems, cooling systems, and behind each one of these components is software as well. So they are quite complex. And when we lose access to a EHR system, it has impacts to our practice, to our health center. The quality of care can be impacted because we do not have access to the patient's health record. We may not recall all of their history. So when that happens, we have to start asking questions, and maybe we have to start asking a lot of questions. And when we do that, that can lead to taking more time than usual. And when we take more time than usual, that leads to lower productivity because we're taking much more time. We can lose revenue because we have to turn away patients, or patients leave because the wait is longer now. So, these dependencies that we have on technology, and if we lose a component in that technology string, can have an impact to our EHR systems and to our practice. Because we have become so dependent on technology, and it nearly works all the time for us, we tend to put how outages occur in the back of our mind and not really think about it. So it's always good, to take a minute and recall some examples of why systems fail. Periodically, I go out and do some research on outages, and in this slide is kind of a capture of those outages that I've come across over the years. So you'll see on the slide, when the outage occurred, who it occurred to, what was the cause, what was the effect, how long it was out for, and what caused the outage. The point here is that things happen that are out of our control, and that's why they're unexpected. So sometimes we have a mechanical issue that causes us to fail, like an HVAC system or a sprinkler system. We don't have sprinkler systems in our computer rooms, but in what happened in this particular situation, there was a sprinkler system outside the computer room that failed, and water started to leak into the server room, so they had to shut down the server room. Sometimes we have outages that are caused by hardware failure. Sometimes we have outages caused by software failures. Sometimes we have outages caused by nature, storms and fire. Sometimes we have outages that are caused by humans, people with good intentions who make mistakes, and people with bad intentions who just want to cause disruption and chaos. So again, just a reminder as to why outages occur, and 9 times out of 10, they're unexpected causes that are out of our control. There have been some studies that have been done over the years with regards to what a downtime situation can cost a medical practice. And some of those studies have come up with costs as much as $488 per hour per provider. So it can be quite expensive. If you extrapolate that out, that comes up with a 10 provider practice that's down for 4 hours, can cost as much as $19,520. Because we have situations that can affect our EHR system, HIPAA has a clause that says we should have a contingency plan or plans for responding to various emergencies or other types of situations that can impact our EHR systems. So when we have an EHR, when we have a downtime situation, what are our options? Well, our options are that we can temporarily close the practice or the location. We can go to paper charts, but that's becoming more and more difficult for us to do over the years because we've become so dependent on our EHR systems and our data. We can implement more fully redundant technology, so we can add network connections, we can add more power systems. We can implement a solution that ensures that you're prepared to handle a downtime situation. And if you think about it in some detail, with third-party hosted systems that have implemented redundancy in their environment, you think about it in some detail, that any one of those components in the chain can break. And if one of those components in the chains breaks, then you could have difficulty getting out to the internet. So as we reflect just what I talked about, that our systems are complex, that our systems are dependent on many components, that downtime is caused by unexpected events that are beyond our control, that downtime can impact our revenue, can impact our productivity, can impact our quality of care. And as we think about these thoughts and reflect on what our options are when a downtime situation occurs, the questions we should be asking ourselves is do I pursue uptime, or do I pursue a solution that enables me to continue doing my business until Athena comes back online? So do I add more redundancy, or do I invest in a solution that lets me continue on doing my work, seeing my patients, while the IT group and others are working to bring Athena back online? Am I going to be reactive or proactive in my clinic's preparedness for downtime? Am I going to be reactive, meaning I already had a downtime situation, so now I want to implement a solution that gets me by until Athena comes back up? Or am I going to be proactive, meaning I haven't had downtime yet, but I want to be prepared in case I do have downtime? Another question I'd be asking is, what are the types of impacts that an Athena downtime situation can have on our clinic, can have on our practice? Those impacts that I just talked about, impacts of revenue. Can it have an impact of revenue? Can it have an impact on productivity? Can it have an impact on quality of care? Another question I'd be asking is, how significant can that impact be to our clinic based on the duration of the downtime incident? Meaning, how significant of an impact to revenue if I'm down for an hour, or how significant is the impact on revenue if I'm down for 2 hours, or if I'm down for 3 hours, or if I'm down for 4 hours. Same thing with productivity. How significant of an impact to our productivity is if we're down for an hour, or if we're down for 2 hours, or if we're down for 3 hours. How significant of an impact can it be with regards to quality of care on our clinic if we're down for an hour or 2 hours or 3 hours? So think about those things and what the impacts can be to the organization based on duration as well. And then how do I minimize the loss? How do I minimize the disruption when I have a downtime situation? How do I minimize the impacts that can happen to our organization when there's a downtime situation? So think about those things. Those are the questions that you should be thinking about as you're thinking about a business continuity solution. The question should not be, will my clinic lose connectivity? Just as we talked about, they're unexpected, so they could happen at any point in time. So as we thought about these questions, and as some of our clients thought about these questions, we designed and developed our ChartGuard product. So it is a cost-effective, easy-to-use business continuity solution that ensures, one, that you're prepared for a downtime situation at each of your office locations, clinical locations, department locations, and that you have access to your patient charts during an EHR downtime situation. So I'm going to turn it over to Joe, and Joe is going to talk to you about how ChartGuard works.
Thank you, Tom, and thank you to everyone attending today. We appreciate you taking the time out of your busy schedule to learn a little bit more about how ChartGuard can help you during an outage. Now, many of you have been with Athena quite a while, and one of the great things about Athena is they keep all the complexity at the back end, right up in the cloud, where you don't have to worry about it. You don't have to build your own mini data center to host Athena. You pretty much just worry about kind of the equipment that faces your users and your patients, but all that stuff in the data center is hosted and managed by Athena, which is great. So when we started working with Athena on ChartGuard, we took the same tactic. We wanted to keep all the complexity of this in the back end so you don't have to worry about it. In fact, one of our main goals is to have a low tech footprint on the front end, because normally when you can't get to Athena, it's because several things have gone wrong. So providing you with another kind of smaller Athena equivalent system wouldn't help, because something's broken in the chain of things that need to work for you to be able to get to Athena. When we started building ChartGuard, we originally worked with several practices in the southern United States. And as we're seeing now these last couple of days, the southern United States gets just a lot of bizarre weather events, right? Between hurricanes and tornadoes, and now this snowstorm knocking things out. And what we see is sometimes there's cases where, yeah, the practice has to close because there's, no power, no heat. But on the fringes of those areas, there's practices that could be open if they could get internet access and the ability to connect to the system. And this is a great spot where ChartGuard fits, because what we do is every night we look at your Athena database, we look at your appointment schedule for all your departments, and we go out and grab all the patients who are coming in for the next several days. And then we pull the clinical information for those patients, and we produce a PDF file of the patient chart that gets downloaded to each of your sites by a simple program that gets loaded on a computer at each site, at each department. All right, so the complexity of that, pulling all that data, pulling documents, pulling images, putting that all into a nice PDF file is all done on the back end where you don't have to worry about it. That process just runs for you night after night, and it's always ongoing. Now, each morning your PC wakes up and it pulls down the latest version of those PDF files. Now, these PDF files, if you think of them as the equivalent of your paper charts, We all use PDF files today, right? We get contracts, we download user manuals, things like that, and they're all in this PDF format. And that's part of the reason we chose to use the PDF file. We were talking about kind of this high-tech back end, but a low-tech front end for you when your systems are having issues. Well, the PDF file is readable on virtually any computer device, right? So you could read it on your laptop, you could read it on your tablet, you could read it on your phone if you wanted to. So having that ability to give you access to the clinical data is important and critical and helps keep your practice running smoothly. And these PDF files get staged on a single machine at each department, and that machine gets appropriately secured, and you're able to either use those files electronically, as we'll show you, within the four walls of that department if the network internally is up and running, or you can simply just print them to paper as the patients come and check in. In fact, we give you an appointment schedule too, so you still know who's coming and when. So we take care of all those pieces. All you need to know is at a particular computer at each location, you have the charts for the patients scheduled over the next few days available to you for those times when Athena is not available to you. And that's a great way to have your eggs in more than one basket, so that you're not dependent on all of these moving parts, all this technology to be working 100% at all times. It gives you another way to be able to get to that clinical data so you have that available for you for your decision making. So what's in these files? We pull the critical information that's needed for downtime, and we pull only the amount that you need. If you think about if you have a patient that's been with you for 5 or 10 years, during an outage, you may not need that appointment from 10 years ago, but you may say, you know what, give me the last 6 months of this, get me the last several encounters of that. So we can work with you to customize what's in each of these PDF files for each patient's chart, so that you're not having a 400-page, book you got to read each time. We're just pulling the pertinent information that you need based on your practice and your specialty. And again, all that's done for you automatically. Normally, when we set this up with you, we go ahead and start with kind of a default configuration. What we've learned is if we show you something to begin with, you're more apt to let us know what you need or don't need versus just starting with a blank canvas. So we'll go ahead and set that up. You'll see some charts right when you get the software installed to pull them down. And then you can let our team know what adjustments you'd like to make to them, or if you just like to take the stock configuration and move forward and try it. We have some clients that do a simulated outage and have a couple providers use the charts for part of a day and see how that works out. Tom, if you want to go to the next slide. All right, I'll turn it back to you, Tom, and you can walk them through the charts.
All right, thanks, Joe. So this is what the the patient chart looks like in the PDF format that Joe was just talking about. So in the front part here is the demographics. So all of the information about the patient, from address, phone number, insurance information with regards to primary insurance, secondary insurance, responsible party information. So that's in the first section, the demographic section. And then the next section is the data with regards to allergies. And you see it's a nice table format here as well. And if you scroll down, here's the medications, again in table format. And each one of these is a particular section that contains the amount of information that Joe was just mentioning. You can also, we bookmark each of these sections too. So if you wanted to click on the bookmark of the PDF file, you could click on that and see all of the sections within the chart, so that you can go to a particular section that you wanted to see immediately. So if you just wanted to see the problems, you could click there. If you wanted to go to the vitals, you could click there. If you wanted to go back to allergies, you click back up. So you have the option to scroll from top to bottom, or use the bookmarks on the left-hand side here to get to the particular section that you want to see. We also bring in images as well. So we can bring in images and have that on the record for you to see. So it's, as I said, scrolling from top to bottom, using the bookmarks left and right. The amount of data here is controllable by you as well. As Joe mentioned during the configuration setup, we can control the amount of information that you see as well. Okay, so that's an example of what the patient chart looks like. So this is just a testimonial from one of our clients. It's an orthopedic practice in Tennessee who took the time to write us a quick email about their experience using ChartGuard. They're a fairly large organization now. They're about 20 physical locations and have been using ChartGuard for several years. After they purchased and implemented ChartGuard, about 6 months after that implementation, they experienced an outage at their 2 largest clinic locations. Prior to implementing ChartGuard, they typically closed the clinic locations that were affected by the outage and had to turn away their patients. With ChartGuard being implemented, they were able to see their patients with minimal disruption using the PDF files that you just saw that generated by ChartGuard, as well as the appointment listing that Joe mentioned that we provide as well to the front desk. So they were able to keep the clinical side of the organization functioning while their IT team worked to bring the EHR system back online. And as you can see from the quote, their physicians were quite pleased with the ChartGuard solution. So that's a little bit about ChartGuard, what it does, how it works within the organization, and the look at the output that was generated as well by ChartGuard that you would have access to. A little bit about Attentive and who we are. We were founded in 2003. We have 20 years of experience in EHR and EPM systems. We have 47 employees in the company, most of which are consultants that travel from organization to organization, working to get as much value out of the EHR and EPM systems as possible. If you take 2003 into 20 years, they do not add up, and the reason for that is Attentive started out as the IT department for a medical organization, and back in the late 90s and early 2000s, when the business mantra back then was focus on what you do best and outsource the rest, the medical organization was going to outsource the IT group. Leaders of the IT group said, well, if you want to do that, what we'd like to do is form our own company and provide services back to you. They agreed to do that, and from that point forward, we worked with over 350 to 400 clients that use EHR and EPM systems. Some next steps. As I mentioned, we just gave you a high-level overview of ChartGuard and what it does and how it works and how it would work within your organization. So if you have an interest in learning more about ChartGuard, my email address, my phone number up on top here, as well as Joe's information. So if you want to reach out, contact us and we can have a discussion. We can even schedule to have a more in-depth demonstration and also discuss with you in more detail about how the product would fit within your organization, how it would work with your current processes, and you'd be able to ask specific questions as it relates to your organization. So with that, we'll turn it back over to Chelsea and we'll answer any questions that you have.
Perfect. Thank you so much, Tom. Thank you, Joe, for the demonstration. And thank you again, everybody, for joining us. If you have any questions, we're going to go through them in the order that we've received them. We only have a handful, so if you have them, now really is a great time to ask. So first question, we have multiple locations. Does ChartGuard back up all of the locations, or is it location specific?
This is Joe. I'll go ahead and run with this. ChartGuard is built to basically create the charts across your system. So if you have many different departments and different physical locations, ChartGuard will produce the charts for all of those, and it'll pull down the charts based on where the appointment is scheduled for that particular patient. So every night it'll go ahead and look at the database, look at the appointments, and as I mentioned earlier, it'll generate the charts. And then on a PC at each location, it'll wake up and pull down the appropriate charts for that one. So it takes care of your whole system, giving you peace of mind.
Perfect, thanks, Joe. Next question, how do you secure the data at the local sites?
We have guidelines for the local sites to help you secure these PCs that are going to run the piece of software that will pull the charts down. It's, the things we'd all expect today: encrypted hard drive, locking down security and permissions, items along those lines. So we can help you with that as part of the setup and installation.
Great, thanks, Joe. Looks like we have another question here. What is the typical number of days your clients generally lose access?
Typically, most network outages, and that's our most common reason people lose access, last up to a day. And sometimes that day will span one afternoon into the next morning if it happens late in the day. But unless there's a catastrophe in the area, the phone company, if you call in the morning, often will have it resolved by the end of the day. This is part of the reason why ChartGuard pulls several days worth of appointments looking forward and generates the charts, so that if you are down overnight, you can go ahead and have that additional data out there for a couple days in advance. Last, ChartGuard will continue to generate the data from the PDF files from Athena's data center. So you could take that software and load it at another location that's still up and running and pull down the charts from a different location if you desired.
It looks like this next question is kind of similar to what you were just talking about, but I'm going to go through it anyways so you can touch on it just to be sure. What's the typical number of days people generally download?
It is typically 2 to 3 days, depending on the size of your practice. We could do more or less. It really depends on the window that we have to generate the charts and the amount of data you want in the charts, and the number of appointments across the system. So we'll work with you on that, but our minimum is typically 2 days, and sometimes we can do more than that. And we have some clients that are doing 4 or 5 days for some portions of the week.
Great, thank you. And it looks like this may be our last question, but if you have more, if you're in the middle of typing, we'll still stay on for a few minutes just in case. We don't want to cut anybody off. Is the pricing based on the size of the practice or tiered on something else?
The pricing is based on the number of charts that are generated each night. Our pricing is there's 4 components to our pricing. There's a license fee, which is a one-time fee. There is an installation, training, configuration fee, which is a one-time fee. And then there's 2 recurring fees, a hosting fee, and then an annual software maintenance fee.
Okay, perfect. Well, thank you, Tom. I'm sure that if you have more specific questions on the pricing, you can reach out to Tom directly. You see his information up on the screen. Likewise, if you think of any questions that you're scared to ask during the presentation or you think of them after the fact, you see both Tom and Joe's information on the screen. You can reach out to them directly. You can always reply back to the email that I sent with the invitation to the webinar, and I'll also be sending a follow-up email with a link to the slides and recording within the next few days here. Basically, any way that you can get a hold of us, we're happy to help, so don't hesitate to let us know what that is. We know that this can be that Athena can be a complicated bit of software, and we're here to make that easier. So any way that we can help you with that, just let us know. That's why we're here. Thank you all for joining us today. I hope that wherever you are, you're warm and you're safe. And let us know if you have questions.
Thank you, everyone. Have a great day.
Thank you very much. Have a great day.